Hello. Today I'd like to talk to you briefly about an initiative that Klingsmith is a part of called FlipthePharmacy. In 2019, we talked to you in many meetings about some of our struggles we've been having financially. As we have shared with you, we are filling the same amount of prescriptions as we have done in the prior years. The biggest problem that we are facing, though, is that because the majority of our business is 92% filling prescriptions, this has had an impact. And the other thing that we shared with you is that we don't get paid directly from a health insurance. Although when people come into the pharmacy, they give you their health insurance card, we get paid by a middle person called pharmacy benefit manager. And we've had differences with their business model and how they have reimbursed us both at the state Medicaid level, Medicare, and commercial insurance. And this has had an impact on us because currently the top two ways our pharmacy and most community pharmacies here in the United States make revenue is through prescription sales and over-the-counter front-end sales. But one of the things we have learned over the last couple of years is that health plans, not the pharmacy benefit managers, have been showing a strong interest in community pharmacies. One of the reasons why they have this strong interest is because we see patients 35 times more than any other healthcare provider. And because we see these patients, things that we do every day for these patients, such as provide immunization for preventive health, like flu and pneumonia or shingles. We also talk to patients about their medication therapies. And when we talk to patients, we're helping them understand why they may not want to take a medication through adherence. And we do this also through our MedSync program. We identify when we go to fill a prescription that there might be an interaction with other medications they're taking, and there might be a safety concern, or the patient might have a safety concern, and we have to talk to the doctor about switching the medication. We also have patients who come in who have questions about how does this medication improve my current disease state, and we educate them to make their better in taking their medications. And why these health plans, not the PBMs, are interested in working with us is they realize the majority of the cost of healthcare is not the prescription portion, but when people don't take their medications or are not on the right medications or do not understand how to take their medications to help prevent their disease from getting worse, there are costs to that. And the biggest costs are in hospitalizations and ER visits. So what Flip the Pharmacy is an initiative to allow us to be able to get to a model, a workflow model really, that frees up the pharmacist's time to be able to talk to patients. And Flip the Pharmacy is a research project and an active research project in looking at how community pharmacies can be the centerpiece in working with other healthcare providers such as doctors, nurse practitioners, hospitals to improve the total outcome of patient care. This grant is through a foundation called Community Pharmacy Foundation, and this grant is happening all across the country with 2,000 pharmacies. Here in Pennsylvania, there are currently 40 pharmacies active, and Klingsmith is one of those. And our first store is the Ford City store. But our goal is to be able to roll this out to all 7 stores by the end of the year. And what Flip the Pharmacy's main goal is to help to help pharmacies to get to a point to free up pharmacists' time so they can spend more time talking to patients about things such as the safety of their meds, improving their adherence of their meds, and having them understand how their meds work with their disease state. But we can't get there with our current model. That is why we have slowly started, currently just in 2 stores, New Mine and Fort City, to roll out workflow. In addition to workflow, the other thing that we have been trying to grow and we will continue to grow in 2020 is our MedSync program. Because in Flip the Pharmacies, there's 6 domains. And the domains are the following. The first domain says it is an appointment-based model, to leverage an appointment-based model. Well, this really is just a fancy name for MedSync. So if you think about this, currently right now, on average across all our stores, we are at about anywhere from 20 to 30% of our patients MedSync. Our ultimate goal is to get above 50% and at least get to 60 to 70% in the next year to two. And the reason why of this, think about an average day in the pharmacy. If we only have 20 to 30% of people med-synced, then the majority of our day is still anywhere from an 80 to 70% guess of what the everyday workflow is when patients walk through our door. And if we're filling on demand versus filling in a workflow where we are able to know when patients' medications are due and filling them ahead of time before they get there, that gives us more control in workflow. And by giving us more control in workflow, it can free the pharmacist's time up to talk to patients and talk to them about the things that I mentioned: adherence, safety, how the medications can improve their disease state. The second domain is trying to get the pharmacist to be more part of talking to the patients in their disease state. And there's many opportunities to do that. First time filled prescription, the 7-day med-sync call. And so we will be working on domain 2 this year also. Domain 3 will, as we roll out workflow and implement it, we'll have to look at the different roles that we help the pharmacist in the pharmacy, whether it's an out front clerk talking to a patient who's having problems and they're there in the self-care OTC aisle and then collecting some information and referring them back to the pharmacist, or whether it's the technicians in the pharmacy or the field clerk technicians helping the pharmacist in getting prescriptions filled in workflow so it frees up their time, or sometimes talking to patients and collecting information that will help the pharmacist to improve that person's adherence, safety with meds, and understanding their disease state. The remaining domains, domain 4, 5, and 6, are focused on partnering with health plans that will pay us for exactly what we do. So, for example, say that you have a patient that you do the 7-day med-sync call and they say, "Oh, I don't need that med." The pharmacist then maybe gets on the phone and talks to them, "Why don't you want to take that med?" Maybe they've had a bad reaction to it, or maybe they don't understand the importance of taking it every day. By talking to them and doing that, and then the pharmacist documents that right there in our Pioneer system, we can then send that off to a health plan to get paid. Currently, right now, we are partnering with the Pennsylvania Pharmacy Care Network, which also partners with a larger national network called the Community Pharmacy Enhanced Service Network. And all these networks are working in our behalf to get contracts with health plans to pay us for talking to patients, not just filling their prescriptions. There's other benefits by getting this workflow model better. As we've shared with you this past year, MedSync provides many benefits to us from a workflow standpoint. It also helps us manage our inventory better, which helps us have fewer shorts for patients and also reduces the amount of inventory we need to carry at hand, and we're closer to purchasing inventory the same time we're billing it out to the insurance company. And all of these things, we are also trying to with our delivery service, have people only have to get one delivery per month. We may have to get creative and maybe do it twice a month, but there's those opportunities. The other thing that MedSync does is it also provides opportunities for pharmacists and pharmacy supportive staff to identify patients who may benefit from other programs, such as our immunization program, and we're hoping to, in 2020 and beyond, roll out other programs to help them with common chronic diseases such as high blood pressure, diabetes, smoking cessation. And though this won't happen all overnight, this is a slowly evolving process to change our business model. We'll always be in the business in filling prescriptions and taking care of patients, and that is our goal. And that is why Alicia and either Dina or Todd met with you today to talk about the 2020 should be getting back to the focus of why are we here, taking care of patients. And Flip the Pharmacy is another program that is going to allow us to do that. And so Rob, will be working with you guys over the next couple months to be able to get you to that point with better workflow, improving our MedSync, and also sharing with the pharmacist and the staff of how we can roll out some of these new programs to be part of our current workflow. There's one additional thing I want to leave you with of why MedSync is so important. The way we get paid for filling prescriptions now, especially in the Medicare realm, we get graded. And our contracts are not always what they say they are. So you may see that, hey, we got paid this much for filling a prescription. But what can occur is if we don't take care of that patient well, if we don't make sure that patient's adherent to certain classes of medications, like medications for their diabetes or their cholesterol or for their blood pressure, we get penalized for that. Even though I know it's hard to tell a patient you got to take that med every day, we get penalized if we don't have programs in place to help improve that. We also get penalized if we don't talk to patients when we are told by the health plan, hey, we need to go talk to this patient about their medicines and their diseases. And we call those CMRs, comprehensive reviews. And we also get penalized, and this is the one we're fighting legislatively, we get penalized based on how many generics we fill and how many brands we fill. And although we don't have complete control of this process and we need some legislative help to improve it, med adherence sync programs can have a big impact on that. So this is just scratching the surface of talking to you about what Flip the Pharmacy is. Please feel free to email me or call me if you have any questions, and I look forward to working with all of you in 2020.